Yes, overweight is a body mass index somewhere between 25 and 30. And although the risks are not phenomenally higher compared to normal weight, it's still a good idea to try to reduce your weight. If your weight is in the obese range, then the risks for pregnancy are very high. Very high risk for miscarriage, for high blood pressure, for diabetes in pregnancy, for a clot, and this risk can be dramatically reduced if your weight reduces. Many people believe you have to overnight move from 90 kilograms to 70 kilograms. This is not a realistic expectation. So if I'm to give you one piece of advice is think of number 10. 10% of your weight is all you need to achieve on a regular basis. So no point in looking at how much do I need to lose, it's just to establish a target. So for example, if you're 85 kilograms, 10% is 8.5 kgs. That's what I want to achieve. You give yourself an interval of 3 months or 4 months, draw a line, have a party when you've lost the 10 kgs and move on to the next 10% till your weight is in the normal range. But there's no better way to ensure you will be healthy and your child will be healthy than to bring your weight to normal. Like with being overweight, being underweight also affects the way the upper centers communicate with your ovaries and your womb, dictating if you will get pregnant or not. It is also important to look at why is it that you're underweight. So let's say that your BMI is just barely 19, which is the lower limit of normal. Is that really a terrible scenario to be? Not quite. But if it is 13 or 14 or 15, you're significantly underweight, and that does not allow for proper hormonal stimulation of your ovaries in order to conceive. But why are you so? Is it constitutional because your mother was a thin lady, or is it because you're running 10 kilometers every night, or you're preparing for a marathon, or you're spinning classes morning and evening? I advise all my patients to reduce exercise if they wish to become pregnant, and that will ensure that your weight goes back to a normal, even if it is a low normal, but a normal.